Hey, good morning. This is Steve Stites, Chief Medical Officer here at the University of Kansas Health System, broadcasting live with you from the Dolph Simons Family Studio. Delighted to be back with you on this Monday morning. Super Bowl 6 days away and counting, another Chiefs victory, back in the driver's seat. We're looking forward to that, pretty excited. Wore a lot of red yesterday, had to get prepped and ready, had to practice my red wearing. I knew I was going to mess that up. Practice my red wearing in order to be ready for the game on Super Sunday. Hawkeye, how about you?
Oh, I'm ready. Went down to Rally House to get some red gear and some Chiefs masks.
But very importantly, you can't change the gear that you've been wearing on game day. It's very important to wear those things that have got us to this point. Don't wear any stuff new.
Don't jinx anything.
Wear the stuff that is, know, is going to bring home the victory. As we know, it's what we wear. Yeah, Mahomes, the defense, Reed, that's important too. But really, it's about what we wear.
Yeah, and if you can be in the same position, you got to do all that stuff because that all matters.
I think that's right. Same position on the couch. Yeah, exactly. Everybody's the same thing. A line in the house is where we want to play to win. Hey, this morning we are joined by the presidents and CEOs of the Kansas Hospital Association and the Missouri Hospital Association. We want to thank them both for taking time out of their day to be with us. Chad Austin and Herb Kuhn are going to bring us up to date on vaccinations and the impact of the pandemic on hospitals. I think as we see numbers start to drop, yes, I think that question of vaccines is going to come bigger and loom larger and larger. So I say the numbers are dropping, Hawk. How are we?
Yeah, we have been very happy this past week.
We have been.
Currently, I think for the city as a whole, the metro area as a whole for new cases, but also here at our health system for hospitalization. So 103 total. And of that, 43 are active infections with 10 in the ICU and 5 on the ventilator. So we still have 60 that are in that recovery period and 8 on the ventilator as well. But overall, certainly the acute infections and numbers have gone down. Hayes is doing a lot better as well, 12 total with 4 active and 8 in that recovery period. So
that's really
kind of shifted, and that's really good for them and their capacity.
That's really down. So 43. I remember when we were in the 30s and we said that was very, very bad, and now we're saying we're at 43 and we're saying that's pretty good.
It's just a matter of, what do we always say? In 2 weeks we'll know more. We'll have, and the infection dynamics will change by time and 10, 14 days, but also in whatever region you're at, especially in the United States. And I think we've been very fortunate here in the Kansas City area.
Why do you think we're dropping?
I think it is increasing mask, and we kind of touched on this last week. The mask culture has improved. We have gotten through those heavy times of the holidays where people are wanting to meet and gather in general. Travel, things of that nature, I think have all gone down. And I think it's just people, more people being aware. We've always had that population that's been aware and trying to do the right things in masking and not going out. A lot of people have been unable to do even the simple things of going to the grocery stores. But I think in general, it's just more and more people who are getting the messages and doing the right thing.
Do you think as people went inside, there was less public gathering? Because I wonder if maybe the outdoor spread when you're close to each other was more significant than we had originally thought, because people were still, okay, I'm outside, I can do whatever I want, but that meant they were getting close together.
Yeah, I think that's a part. I think there are so many aspects to that. I think that is definitely one of them. We have to remember that we can't just say, oh, well, there's not enough cases, or there's not as many cases because you're not testing. Even if we weren't testing and those cases were still out there, they would still be coming to the hospital, and we would see those and reflected in those numbers, but we aren't seeing it, so that's good. So I have to believe that overall, yes, truly the number of infections is down. And it's for a number of reasons, and it's not just one thing, but I think we still have some work to do, but I think it is a lot better than where it was, November 1st. Certainly our numbers now are more like they were like October 30th as far as number of 7-day rolling average of 10 hospitalizations and new cases.
And we're even seeing like our own employees being off from work due to COVID. Those numbers are dropping dramatically. But I think a lot of it's vaccination. I think vaccination works as we vaccinate those who are in nursing homes. That's going to cause less folks coming into the hospital too. So I think in general it's just all good news. And we like good news. Hey, but before we get into this morning, I was supposed to have a shot today. I know you all were really keen on seeing my biceps, although it doesn't take very long to see that. But instead, I'm going to be getting that Moderna booster tomorrow. It's actually a good lesson. It has to do with vaccine logistics, and so it's a good teachable moment. We were scheduled for a first shot clinic today, so I was going to be able to use that shot in order to get my shot. But in fact, we don't have vaccine, so we can't give the first shot clinic today. And instead, there is a follow-up clinic tomorrow, and I'm going to get one of those. We couldn't open up a vaccine, which would have taken 10 shots, and I would get one of them, then what are we going to do the other 9? So instead, we're just going to use the one. So tomorrow morning, you can tune in. I will have my booster shot here on the program tomorrow. We'll be giving those boosters because we've got plenty of vaccine to give people their second shots. We just don't have any more doses right now for our first shots or to give it to the general public. By the way, I'm not sick, although some people would always think maybe there's always something a little wrong with me because I'm just a little off. But beyond that, things are all good. Hey, I do want to start bringing in our guests, and we have questions for both Herb Kuhn and Chad. And so, Chad, let's start with you. How many hospitals in your state do you think have been impacted by the pandemic? And I'm going to guess it's like A, all the above, B, all the above, C, all the above, D, all the above. How about that?
Yeah, first of all, Dr. Stites, thanks again for allowing us to be on the show today. And thanks you and your team for everything you guys have been doing with educating folks throughout the entire state related to the COVID pandemic. As it pertains to the impact of our hospitals, all 122 hospitals that we have in Kansas have received various degrees of impact related to COVID-19. As we've been looking at this over the course of the last 12 months, it's been a roller coaster ride for many of our hospitals. We've been putting things into buckets in terms of how we've been approaching items related to this. You may anticipate that at the very beginning of the pandemic, it was all about hospital capacity, making sure that we had sufficient hospital capacity. In addition, we were trying to preserve PPE and working through ways of securing supplies of PPE for our hospitals. That also had an impact on the ability of our hospitals related to staffing, and so had a number of staffing issues over the course of that period of time as well. And then most recently, we've been really focused on a couple of different things. You've been talking about the public service announcements on mitigating factors related to the spread of COVID-19, and that's been a big role that we've been playing from a hospital association perspective, but also looking at testing and making sure that there's adequate testing that's out there. But the vaccines, as you've hit here over the last few minutes, has been kind of the priority for the Kansas hospitals across the state of ensuring that we have adequate supplies of vaccines to not only vaccinate our frontline workers, but also getting in that next phase here, hopefully in the near future, to be able to vaccinate some of our public members as well.
Yeah, that's so important. So, Herb, same story in Kansas. Is it going, has it affected most every hospital, do you think?
Yes, all of the above. And in fact, hospitals in Missouri, I think, feel like they've gotten the Mike Tyson treatment, as all hospitals across the country. And as Tyson was famously quoted as saying, everybody has a plan until they get punched in the face. And believe me, hospitals have been punched in the face many times. But the cool thing about what's going on in Missouri, and I think elsewhere across the country, is hospitals, physicians, nurses, others have really punched back as well, and punched back hard. And we see that across our state. And overall, whether it's the federal waivers, whether it's the federal financial assistance that's come in to stabilize, the opportunity to do telemedicine has done great things to help us manage and punch back in Missouri. Likewise, if you think about the story of the pandemic, it's really a story of shortages. Shortages in terms of, first it was PPE, then testing, now workforce, and now vaccines, and everybody's worked and adapted very well to those shortages. And then I think finally, in terms of the hospitals across our state, they've been very adaptable. They've been learning organizations in terms of how to treat these patients, how to get the message out for mitigation, to do all the things necessary to get us to where we are today. And that's been both in the quaternary and tertiary hospitals in the urban areas, but also the rural areas. They've been able to adapt and really take care of some very sick, high acuity patients that are out there. So it's been good to see. It's been good to see everybody be able to punch back. And I think with the vaccines, we're really going to be able to punch back hard now.
I do too. I think that's what we call it, going on offense. We were playing defense forever, and then when that first stuff came, we said, game on, we're on the offensive. And that feels a lot better than always being on the defensive, I think. So have the hospitals, Herb, have the hospitals in Missouri mostly vaccinated their teams?
Vaccinated. First vaccine in Missouri was delivered on December 14. and everybody worked very hard. But there was a bit of a bifurcation in Missouri. Obviously, with the Pfizer vaccine and the ultra-cold storage that was required with that one, that was delivered largely in the urban areas, and people were very, very effective of kind of moving aggressively to get that area. The rural areas are still a little behind, and we do have some rural hospitals that have still not seen any vaccine for their staff. And most of those folks were to get Moderna vaccine, but the state made a very important decision early on in the process to divert all the Moderna vaccine to long-term care, to really try to get those residents and ultimately those clinicians and those organizations vaccinated. So we're starting to catch up now, but we've got a good solid stake in the ground in terms of staffing at hospitals, and it's going well.
Chad, how about Kansas? How are we doing with vaccinating staff in Kansas and moving into phase 2 now as well? Talk to us a little bit about that.
Sure, Dr. Sides. A couple things related to that. Back in the late fall, we had worked with the Kansas Department of Health and Environment in terms of assessing our hospital needs as it pertains to vaccines for their staff. And then as we approached the middle of December, when the Pfizer vaccine was made available, one of the commitments that our state made was to make sure that we got the vaccines to as many of our hospitals throughout the entire state of Kansas. And that first week, we actually had over 100 of the 122 hospitals that we have in our state had the Pfizer vaccine delivered to them. And so we were really pleased about how quickly we were able to get that across the state. And then over the course of the last couple of weeks of December, what happened was the Moderna vaccine started showing up within Kansas, and we were able to get the vaccines to those remaining hospitals. And at this point in time, for the most part, it appears as though that all of our hospitals have had some version of either the Pfizer or the Moderna vaccine. And then as it pertains to being able to staff all their employees and their frontline workers, we're not quite there yet, but we're almost there. And I'm pleased to report that hopefully here in the near future, we'll be able to get that resolved and then get all of our frontline workers vaccinated at our hospitals across the state.
Yeah, that is good news. And do you think hospitals are going to be helping with public vaccinations here in phase 2, Chad?
Yes, that's one of the things that many of our hospitals have already started reaching out to our state to see how they can participate and help serve their local community members. As we enter phase 2, and with the shortage of vaccines, as you know, that we're seeing across not only Kansas, but also across the country, one of the items that our state will be doing is focusing on getting those vaccines to the local health departments. And so the local health departments throughout the entire state will be the ones helping quarterback where the vaccines will be going. Our hospitals will be working closely with many of the local health departments related to that. And then as we get more vaccines within the state of Kansas, what I do believe will happen is that the state will start engaging directly some of the hospitals to start vaccinating their community members. And then that's going to be a complete team effort, because not only are we going to have to focus on local health departments and hospitals, but we'll also need to be working with our physicians, the pharmacists in our local communities, because it's going to be a team effort to be able to vaccinate all the population that would like to be vaccinated.
Herb, how about in Missouri? How does that look? What are the rural hospitals going to play for vaccinations?
They're going to have a significant role in the vaccination process. And for us, I think, like everybody across the country, your true north is saving lives. So you want to be involved in this vaccination process because, as I mentioned earlier, this is our chance to punch back. And it's going to require an unparalleled, all hands on deck, major logistical effort. And the nice thing that what hospitals bring is they bring infrastructure, both in terms of physical plant, but also in terms of staffing to be out there as we move to kind of drive that vaccination effort forward. So I don't want to jump the gun on our governor, but you'll probably see a major announcement from our governor today in terms of more activity on the vaccination process in Missouri, which will include a lot of activity from hospitals. So we're excited about that opportunity and really ready to get going. And the important thing about the vaccination process, as I said, that we need kind of all hands on deck. Earlier last month, we did some polling. Our association went out and polled about 800 people across the state, a very scientific poll, to kind of find out what is kind of the interest in vaccination in the state of Missouri. And what we found is that about 58% of the people in the state said either they were likely or very likely to get vaccinated. If we want to hit herd immunity, we need about 75%. So that showed us the gap analysis that we really have a lot of work in terms of education and make sure that we have vaccine sites available to people all across the state. But there was some good news in that polling. It showed that seniors were really excited about getting ready to be vaccinated. We also found that we've seen nationally that African Americans, Black and brown individuals were concerned about the vaccination process, both the vaccine as well as the fairness of the distribution process. And then regionally, what we found is that, at least in the Kansas City area, that polled the highest in Missouri for people who want to get vaccinations. So that's exciting to see that kind of level of enthusiasm and the willingness to get vaccinated in Kansas City. We hope it bears out when the vaccines are available.
Yeah, I hope that's right. And I think there have been some game-changing information coming out in the last few days with Johnson & Johnson and Novavax's announcements. In a best-case scenario, when do you guys start, and Herb, I'll start with you, when do you start thinking we may get J&J and we may get Novavax? Those are going to really substantially help our vaccine quality or quantity.
It sure will, because at least on the J&J, it's a one-dose or one-shot regimen. And if you think about the state of Missouri, we got 6.1 million people. That's over 12,000 vaccinations. Wouldn't it be nice to be able to do that with 6 million instead of 12 million that's out there? My understanding from everything I've heard and read is that the emergency use authorization will be put in within the next week or two. Hopefully, people are expecting to see that vaccine online in March. But boy, that just brings another arrow in our quiver. And the more vaccine that we can get, the more shots we can put in people's arms. And I know healthcare providers all across this state are ready to go to work doing that.
Yeah, that's for sure. And Chad, Johnson & Johnson, one shot, room temperature, or refrigerator, it can be in room temperature a little longer. Does that mean we're going to start getting vaccines into actual physician offices as opposed to more mass distribution? What are your thoughts about that?
Well, we would hope so. You know, as I mentioned, it's going to take a team effort across the country, but also in Kansas, in order to be able to vaccinate the population that would like to be vaccinated. And so, as Herb mentioned, the more vaccines that we can get available, the more ability we're going to be able to have to vaccinate those individuals that want to be vaccinated. So, looking promising as we're moving into the future.
Well, and I'll say, I think Dan and I know we speak for the health system when we say, in this situation, we want to be all hands on deck, and whatever we can do to help, we want to help because, you know, we're a border state, right? Or at least a border hospital, because we're about a third of our folks, a little bit more than that, come from Missouri. The other 2/3 come from Kansas and some surrounding states. But we really feel like those of us involved in healthcare want to play a major role in that we do this every day. We vaccinate patients every day. And some of the health departments have been a little undermanned over recent years. The public health infrastructure isn't as strong as it needed to be to handle this pandemic. So I think that partnership between physicians' offices, hospitals, pharmacies, and health departments is the answer to try and make sure we get everybody vaccinated in as timely fashion as possible. So, Herb, what are you seeing coming from the new Biden administration? How is that going to be different?
So I think, in a word, ambitious. I think they have a very ambitious plan to move forward, but I think they've got a couple of hiccups early on in the process. One is the pandemic. I think as they're getting into this, they're finding that their challenges are greater. Moving vaccine and to get the 100 million shots in the first 100 days is going to occupy a lot of their time. The other issue that I think they're seeing is that the tight nature of Congress. Senate is a tie, 50-50, and tight margins over in the House. But I think you're going to see a lot of movement in a number of areas. Certainly on coverage is going to be important, not only for those who get their coverage through the marketplace, but also on Medicaid expansion, maybe creating some new enticements for new states to come on board. I think you're going to see a lot of work in terms of trying to lower the cost of prescription drugs, dealing with transparency. I think workforce retention and trying to recruit new people into the healthcare workforce is going to be a major issue with them. The continued expansion of telehealth. I just see a lot of good things on the horizon for them to move forward. They are going to have some issues on Medicare, though. As we know, a lot of effort within the Democratic Party, whether you want Medicare for all or something that's more traditional Medicare. But I think that's a debate for a later day once we get beyond this pandemic.
Yeah, I'm hoping we get vaccination first, then we'll talk about that piece of it. But Chad, talked about us. First of all, what do you think is going to happen with Kansas around the changes in the Biden administration? And does this change the public's appetite? Has a pandemic changed the public's appetite around Medicaid expansion in Kansas?
Well, that's a great question. As we look at what's happening on the federal level, Herb kind of outlined what we anticipate could be some of the significant challenges and opportunities from the Biden administration. And then as we look at Medicaid expansion and what may happen, there could be some incentives that the administration will be coming forward to those 12 remaining states that have not moved forward with Medicaid expansion. Kansas right now is on an island. Each of the surrounding states, Nebraska, Colorado, Missouri, Oklahoma have all moved forward with Medicaid expansion. And so we're basically surrounded by states that have moved forward with that program. What we're hoping for, as we just mentioned, is that possibly some incentives to be able to get those 12 remaining states and not sticks, in essence, of penalizing states that have not moved forward. From a perspective of the public, I do think that there's still an appetite for Medicaid expansion. There's been poll after poll that's been done over the last several years that continuously shows that there's public support for Medicaid expansion. And so hopefully our policymakers here in Topeka will take advantage of that and we'll find a solution that's right for Kansas.
Yeah, good luck with all that. Well, let's see, Jill, if there are reporter questions online.
Good morning, Cody Holyoke, Channel 9.
Hi, Cody.
Hey, guys. Couple things. First question is off of something that Hawk said a little earlier on, is that we're kind of past this point of those heavy times, he said, where people want to meet and gather. Super Bowl 55 is on Sunday. So what are the main concerns going into that? Because that is almost like a holiday. It is a holiday in Chiefs Kingdom.
It is a holiday, and we got to be really careful, don't we, Hawk?
Yeah, no, I wasn't trying to say, I had that on, but it's not Thanksgiving and Christmas and all the parties in between there. It's certainly that one episode. And we kind of tried to address that last week as well. It's going to be very important for people moving forward to continue to do that stuff during the Super Bowl. And that is not meet in those large groups, not expand your bubble. Because we know those super spreader events can happen. So continuing to do that, and that is a cause of concern, but we addressed it last week. We'll continue to address it this week. And this goes for everybody, especially if you're having workplace or inviting people from your workplace. Because if there is somebody there with the infection, then it could ultimately rule out 3 or 4 people from being able to go to work. We know there are workforce crunches, and not only in the healthcare, but other aspects and other businesses too. So it's going to be important moving forward to continue to do that, not have that large gathering, not increase your bubble.
Here's the problem that I see. You want to take some time off for the Chiefs and take a little time off from the rules of infection control, okay? It's a bit of a gamble because you know what? The virus does not take time off. The virus works overtime every moment of every day to infect you so that it can have a reason to spread, mutate, and go on to the next person. The virus does not take time off for the Super Bowl. You still have to follow the rules of infection control without question. Keep your gathering small. Make sure you're staying inside your bubble, wear your mask. And no, I don't want to be Debbie Downer and Don Killer here about trying to kill all the good fun. But the reality is you have to stay safe because there's going to be a lot of seasons to watch Patrick Mahomes coming forward. Don't blow your chance. Let me just turn to our guest for just a moment. Herb, how are things in Missouri hospitals overall? Are you seeing the same downward trend we're seeing here at KU?
We sure are. Last week, for the first time since the last weekend in October statewide, we went below 2,000 inpatient hospitalizations across the state. In fact, down to about 1,900. That means bed capacity, ICU capacity is coming up again. And just as you kind of talked about at the top of the program, that's the very same kind of numbers that we're seeing in Missouri. So it's a good trend. And we hope that trend continues throughout the following months.
Right, and Chiefs Kingdom, don't change that. We want that trend to keep going. Chad, same thing true in Kansas?
That's correct. Yes, we've seen some decreases throughout the entire state. And so certainly there's some pockets throughout the state, but for overall, we've seen a decline, which is very favorable.
Excellent. All right. Any other reporter questions?
Yep. Second question now.
Please.
Based off of something that Herb said a little earlier, that this is an issue or story of shortages, he said. I know that news came out from the Jackson County, Missouri Health Department on Friday saying, look, we requested shots from the state of Missouri. We got 0 first doses. Just your take on that and what your hopes are, what the main issues are, and how do we get over those hurdles?
Really, it's an issue of of working within the systems that we have and doing a very good job of scheduling those that want to get vaccinated in the process. Too often what we're hearing stories, just like you said, where organizations are either canceling vaccination clinics or they are putting out news that's of disappointment. I think with the new Biden administration, for the first time, we're going to get a line of sight, what they're saying, up to 3 weeks. So we'll know 3 weeks in advance what the vaccine supply is going to look like. And I think once we get that kind of more predictability out there and a cadence to the system as we move forward, we're going to be able to avoid those kind of hiccups along the way and really move through an orderly process, scheduling people so we don't have a lot of people standing in line, crowded together. But if people are properly scheduled for the first dose and the second dose, with that 3-week window, I think things are going to really start to level out here in the month of February. And like I said, we're going to get a much better cadence on vaccination.
Herb, one thing, just to follow up on that, it helps us all to have credibility around transparency so we don't continually look like we don't know what we're doing. I think you're right. Giving that longer line of sight will make a huge win for all of us. Cody, did you have a follow-up with that?
No, I'm good. Thank you.
Any other questions?
Hi, guys. It's Taylor at Channel 41. How are you this morning?
Hey, Taylor. Good.
Hey, Taylor.
Wanted to check in with you on something that was happening yesterday. On Meet the Press yesterday, Michael Osterholm, who's one of the director of the Center for Infectious Disease Research in Minnesota, talked about that we need to call an audible, he said, and be putting more first vaccinations into people and getting that to as many as people as possible instead of worrying about second doses as much as we are. Does the timeline of and I know you've already mentioned Johnson & Johnson be a 1 dose could be a game changer, but does the timeline of Moderna and Pfizer being the 3 to 4 week span there between the first and the second make that kind of a pointless argument? Like once you've done one of those, if you're not concerned about when the second one's going to happen, is that doing the wrong thing?
So I'm going to just throw this open to the group, and I'm going to lead it off. And here's what I think. I think that if you actually look at the J&J data, it's around 67 to 72% effective with 1 dose. If you look at Moderna and Pfizer, they're 95% with 2 doses. But if you go back to those groups that only got the 1 dose, it turns out to be about 60 to 80% effective after 1 dose, which means they're both about the same level of effectiveness after 1 dose. So it's a question. You do have to audible here at the line of scrimmage. Do you want to decide that we're going to vaccinate as many people with 1 dose, which may have some importance around variants, or do you want to try and give people 2 doses, which is what's really going to keep hospitalizations down? So I think that's the essential question we're faced with. That is a temporary question because in about 3 months, I think our vaccine supply is going to ramp up and this won't become as much of an immediate issue. But for the next few months, it is. So let me turn to Herb and to Chad first, and then I'll have Dana kind of bring us home and wrap it up because this is a great question. Let's take that on. Do one of you guys want to go first? Chad, let's start with you.
Well, I would just say from our perspective, just a lot of patience in terms of working with those high-risk groups. As you mentioned, ideally we'd like to be able to get vaccines in everyone related to the 2 doses for Moderna and Pfizer, if we can get the J&J one available here in the near future. I think it's really about getting maximum potency in terms of the vaccines.
Okay, so maybe a little better, get both of your shots that you need to, and even J&J's talking about, if we go do a trial with 2 doses, I bet we're at 90% effective, just like Pfizer, Moderna, and Novavax. Yeah. Herb, what do you think?
Yeah, I think with this new 3-week window, I think the opportunity to really kind of drive the second dosage is going to be very important and much easier to kind of manage as we go forward. And you said something earlier, the fact that when you get that higher immunity level with the second dose, it reduces hospitalizations, but also importantly, it reduces death. And I think, again, our North Star on all this is saving lives. And if we can save more lives by getting that second dose in people's arms, I think that's something we just need to look very, very hard and continue to persevere and move forward on.
Mm-hmm. Hawk, what do you think?
Yeah, right now the best data that we have for protection against severe illness and death is the 2 doses for Moderna and Pfizer. Now, if you have to push those doses out, and if this does become guidance, if you have to push those doses out, say another 2 to 4 to 6 weeks to get that second booster from when you normally would, that's probably still going to be okay because you're actually going to be then boosting that specific immunity that was created during that first shot. So a delay is probably not going to be as bad, but the best data that we have is that you do get those doses, those second doses at that 3 or 4 week time frame. but I think delaying it another 2, 3, 4 weeks is probably not going to be detrimental. It will still be beneficial. But right now with Moderna and Pfizer, the guidance still is, we still are recommending 2 doses to complete the series, because that's where our best data is.
So really maximal immunity over more arms is what you're thinking right now. So, and I think that's an open question right now. I think Fauci is still saying, I was listening to an interview you gave this morning, it's still important. You got to get maximal immunity.
Yeah.
I think, talking about North Star, I appreciate that. That's a great way of doing it. Fauci's sort of my North Star, because the guy's been through so darn much and through so many pandemics. And are we all wrong some of the time? Well, of course we are, because we're building the airplane while we fly it. But in the meantime, that guy, to me, he's been the voice of reason this entire time. When Fauci changes, I'll change. But in the meantime, I'm thinking, let's get everybody maximally immunized, as opposed to more arms with less immunity. And I think that's the direction I would go right now.
Any more reporters?
Any more? Yeah, any other reporter questions?
Okay,
Hearing none.
Virginia has.
Jill, let's do it.
Yeah, and you may have kind of answered this, but she says, if I can't get the second Pfizer dose, should I just get the Johnson vaccine? And I think you ought to speak to mixing
Yeah,
them.
why can you not get the second Pfizer dose? I think there's enough, and I'll turn to Herb and to Chad here, but I think we've got this figured out for our second doses. There shouldn't be anybody who can't get their second doses. Is that right? Herb?
Yeah, from our perspective, as we've been working with the Kansas Department of Health and Environment, everyone has been allocated that second dose. And so that should not, at least from what we're hearing at this point in time, should be a problem for individuals to get that second dosage if they've already received the first.
And on the Missouri side, it shouldn't be a problem. In fact, when people are scheduled to get their first dose, before they leave, they're hardwired with an appointment to come back for that second dose. So there should be no hiccups in the system, hopefully, to make that happen.
I saw a note over the weekend from a person who had been in another state to get and we get a number of these notes, by the way, had been in another state and just happened to get the first dose. Now he's back in one of our states and wants to get the second dose. And it's like, well, that's harder. What do we do with folks like that, guys? What do you think, Herb?
That's a good question. We have the issue in terms of Missouri, Kansas, and folks who work on one side of the line and come over. So I think they've pretty much got that figured out, how to deal with that population on the vaccination. But if they come from a much different area, I think that's a bit of more of a challenge. I think, think about it in terms of the shingles vaccine, which was a 2-shot regimen. And everybody was pretty disciplined to make sure that you went back to the same pharmacy or the same primary care physician to get that second dosage. And I think most people are probably going to stick to that kind of regimen.
Chad, same thought?
Yeah, for the most part, that's what we're encouraging individuals to do. We do know there could be some isolated cases where we may need to be flexible. And in those cases that we've seen thus far, we've been able to have some flexibility to ensure that that individual has been able to receive their second dose.
Hawkeye, what do you think about mixing the dough with J&J if you've already had Pfizer?
I would probably say no at this point. The guidance is only in exceptional circumstances should you mix Moderna with Pfizer. There's probably little, if any, data there. It's probably okay and safe, but we just don't know. If you aren't able to get your Pfizer second dose, then I would say just delay it then, that 3 or 4 weeks. As Herb said, we do have a line of sight. There should be supply there. So waiting to delay that 3, 4, or 5 weeks for that second Pfizer dose, do that. But I would not go from Pfizer to J&J, especially because that's a whole different system. At least with Moderna and Pfizer, it's the 2 of the same platforms, and you're going to be getting a second dose as well.
And the other thing just to say is that if J&J is 70% effective, and Moderna's and Pfizer's are somewhere between 60 and 80% effective with one dose, you essentially haven't done anything. You've switched whole modalities. It just isn't the same.
No.
To me, I wouldn't do it. But I think I'm with you. We heard from Greg Pollard from the Mayo Research Center that you can wait several months and get your second dose.
Yeah.
And so I just say wait till the Pfizer comes in.
Carla needs some clarification. She says she understands that if you've had COVID, you should still get the shot. However, she said she thinks that you're supposed to wait a couple of weeks past symptoms. Her somebody, I don't know if it's a husband, a family member has lost their taste and smell. It's not coming back. It's been more than 2 weeks. How long do they wait? What if it never comes back?
Yeah.
What do you think, Hawk?
Yeah, no, the guidance for this is, there is no minimum time between getting infected with COVID-19 and getting your vaccine. What we do like is that if you are acutely ill and you have the infection, we would like you to wait at least that 10 days before going out into public because you need to be in isolation anyways. So wait that 10 days until you can get back into society so that you're not going out to vaccine clinics, waiting in line or waiting in a large area with other people and the ability to transmit that disease. But once you are really after that 10 days of isolation or after that acute period, you can go ahead and get your vaccine.
Yeah, an interesting article was in the New England Journal this last week looking at how long the virus you shed is viable. Because I think what they found is people were shedding virus particles for up to 3 and 4 months, but they only shed virus that was culturable. The maximum was 13 days. So really, you're not infectious after 2 weeks. I mean, that's really what that said to me.
Yeah, barring any other immunocompromising conditions and stem cell transplant, chemotherapy, things of that nature,
You bet.
your ability to shed, and even when you shed that live virus, in what concentrations, and is it those transmissible concentrations?
Yeah. So it's pretty safe, I think, after that. Okay.
Laura, does the COVID rash in an adult have a link to the possibility of blood clots?
Huck.
I'm not aware of any specific prognostic factors for blood clots.
Yeah, I'm not either. What I would say is there are certain rashes that are consistent with like cryoglobulinemia and things that can be, but those are very large areas of sores that appear on your skin. If you have something like that affected with COVID, that could be a sign of blood clot that I would want to be getting immediate help for. Yeah. But the general rash, probably not as much.
Craig asks, with the previous pandemics or epidemics, they just disappeared after 2 to 3 years with no vaccine, such as the Spanish flu. But this one doesn't seem like it works that way. Or could it all just go away?
What do you think, Hawkeye?
A simple answer is probably no. So, he talked about influenza. Well, we know influenza is still here. It just changes from year to year, or the dominant circulating strains change from year to year. We also know that we have 4 common cough and cold coronaviruses, which have been with us, for hundreds of years, that are still endemic and circulating throughout the world. Luckily, they do not cause the same level of infection or disease that SARS-CoV-2 does. In addition, I think we got very lucky with SARS-CoV-1 in the fact that it did die out. But that was a lot different dynamics. Again, you were probably not infectious till 5 to 7 days after symptoms started. So they could very easily do contact tracing, quarantine, and isolate those people. For here, we know that there is a significant amount of viral replication that occurs before you get any symptoms, and you're able to spread it from person to person. So the simple answer is no, it probably will not die out. We also have to remember that MERS, which is really prevalent on the Arabian Peninsula, still has not died out, and we see a handful of infections with that every year as well. So I don't anticipate that it will die out either.
I would also remind us that smallpox and polio never died out until after vaccinations.
Yeah.
And so I would not take it's a very optimistic view that after 2 to 3 years it'll die out, but there are a lot of diseases in human history which chose not to die out, which has only died out because of either A, we've got effective vaccination, or B, we have other forms of effective therapy that has mitigated the risk. So I think that's probably the way I would take a look at that.
Mary saw a news report that said BGI, a Chinese company that provided COVID tests, was accused of sharing DNA from the test. KU is said to have used their test. She wants to know, has my DNA been shared?
Shared the DNA.
I don't know.
How do you know what that? I'll tell you, your DNA is not shared. We don't go around selling DNA. That would be a bad thing. So, but let us try and get into that question a little bit more. We probably need to talk with Rachel Leisman a little bit about that. I assume that means that they're actually taking the PCR. On the PCR from the nasal swab would be some DNA, and maybe they're doing something with it. I don't know. I've not heard that. Let's do a little reconnaissance.
Isaac would like to hear more about how Kansas and Missouri are coordinating resources when it comes to the metro.
Oh, let's do that one. I love that question. Herb, what do you think?
There's been some really good work with the hospitals on both sides of the border who come together on a weekly basis, and with the chief medical officers and many others in the organization to kind of coordinate response, share information, a number of issues. So this has been going on for months since the very beginning. Also, there's other groups in the area that have been kind of working to try to bring folks together, but it's largely been a response of the private sector. I think perhaps maybe when vaccinations get going, we'll probably see public health authorities and maybe some more of the government entities coming together. But so far, I think some of the coordination, information sharing has been really well done so far.
Chad?
Yeah, I would agree as well with Herb pertaining to that we've seen a lot of collaboration and partnership in the metropolitan area, not only with the hospitals, but with the local health departments, with the local government. And so that's been a positive aspect, I believe, from what we've seen with this pandemic.
And I would just say our CMO call that you referenced has been great. We started that in late March, and we've been on the phone every week, sometimes 2 and 3 times a week, visiting with each other. There was a time, I remember in October, where the CMOs rallied together to make a public statement about the threat to hospitals and tried to get people more involved around masking. I think that led to some major changes here in the Core 4, and I think that's been great. I always say God has a sense of humor. I grew up a Missouri Tiger, man. I went Tiger everything. Kansas, no. K-State, no. And then, God laughed at me. I got a job. I did my fellowship here at KU, and I've been at KU ever since. Now I'm a Kansas Jayhawk. I call that being a Tiger Hawk. It's a rare breed, but it is possible. And I think that's kind of the point of it is that you can be a part of both. And actually, we are all part of both because we share a common community. I think Lee Norman was on our program one time, and he said, I don't really care where you come from. Just give me your arm. And I think that's the right answer. Give me your arm. Because if our North Star is death, we don't care where you're from. Let's just give me your arm. Let's get you vaccinated, and let's go. And as we get more and more vaccine, I think, right now people want to focus and say, well, the state line's an issue. Well, no, not really. The issue is there's not enough vaccine. As we get a lot of vaccine, I think what we really want is a lot of arms, right? And I think that call to arms is not going to be respective of state boundaries. Guys, any thoughts about that? Herb?
I think you're spot on. I think you said it perfectly. This is one where there's an unparalleled response. The collaboration, the coordination has been something like I've never seen before. And this is going to really test governments and organizations on this vaccination efforts like we've never been tested before. And I think people are up to the cause and ready to do it. And I think they're going to set aside any kind of pre-existing notions about either side as they go forward. It is our North Star. Let's save lives.
Yeah, I think so. Chad, thoughts? Because with Kansas, you also got to think about Colorado, Oklahoma, Nebraska, et cetera. And Missouri's got 8 states bordering it, so.
Yeah, we actually have been working with our surrounding states as well, not only the regional area and the Kansas City metropolitan area, but also working on regular communications with our colleagues in Oklahoma, Nebraska, Colorado, seeing how we can best coordinate some activities with them as well.
I think that is so important. And it's going to be a change because right now there's just not enough vaccine. But before you know it, we're going to have a whole lot of vaccine, and then it's about coordinating our immunization responses so we can get that vaccine into arms. And I think you guys hit it on earlier in the program. We got to follow and find every possible way of doing this vaccine that's safe. We can keep track of it, but we got to get it into arms. And to me, that's through hospitals, health departments, offices, pharmacies, and wherever else we may go in order to get that vaccine out there. And I think that's just a few months away, right? I mean, what do you guys think? When do you think the vaccine supply will really ramp up, Chad?
Well, we're hoping that here in the next 30 to 60 days, we'll see quite a bit more vaccines coming into our state. We've already started conversations with the Kansas Department of Health and Environment, as well as the other provider groups, as you mentioned, working in collaboration with local health departments, but also reaching out to physician offices, working with the pharmacies across the state of Kansas. And I do think that that's going to be something that it's going to be all hands on deck as we try to vaccinate as many people as possible that want to be vaccinated.
Herb, when do you think the day is going to come where you're going to be able to, a patient or a person in the community is going to say, you know what, I just want to go get my vaccine today, and I don't have to worry about the quantity of supply?
Let's hope that day's not too far out. I think the ambitious goal that the president has set of 100 million doses in 100 days, which is a floor. It's not a ceiling. And I think that's a great goal. And let's hope when the J&J, if they're successful on their emergency use authorization request, is successful, that come March and April, we are in great shape in terms of vaccine availability, and we're just plowing through our populations as quickly as we possibly can.
Yep, I'm with you.
All right, Emily says, a coworker tested positive last week on Monday, so we started our 14-day quarantine as of last Monday. Another coworker who had been around last Friday with masks on just started symptoms last night. Does that mean we start our 14-day quarantine all over again?
Hawk?
It's a little bit
Yes.
hard for me, but it's going to be the quarantine starting from the day of last exposure, essentially.
Yeah, I think it's 14 days.
Even with the mask on?
Well, so, you have to be a little careful because it depends on, A, did you really have your mask on? How close were you with you? What was the environment you were around like? You have to parse that out a little bit.
And right now, there's no distinction. And really, historically, through all this with the CDC, there hasn't been any designation of masked or not masked. It's been proximity and time. And so if you're in that contact period of the 15 minutes and the 6 feet, then it's still quarantine. And it's going to be from your last day of exposure to that original case, not to somebody else who was in quarantine as well. It's to that original exposed case, the last date of exposure.
All right.
Last question.
Betsy wants to know, my parents are in their 90s. They have both doses of vaccine in a couple of weeks. Are we okay to get together around them without masks, take them to the store,
What do you
get
think,
my
Hawkeye?
mom's nails done?
They both had their vaccine. They're older. What do you think?
I think this depends on what your bubble and what your interaction with them has been historically, in the past few months. Certainly, we know that getting the vaccine for both people, either you or your parents, you still have to continue to mask and distance and not meet in large groups in general for everybody who's gotten the vaccine. But this case specifically, have you been doing that already, or have you been meeting with them with masks? Because is your bubble different and you don't want to possibly get it and be asymptomatic and give it to them. So I think a lot of those things will help determine that answer.
So, and my only other comment is remember that we don't know if you can still shed that virus. And if your folks are living, for example, in a nursing home or an assisted living or something like that, then they could get sick and still shed it to other members of that. And hopefully everybody's unvaccinated because that's the whole point. But I think the key is continuing to wear masks. There's this gray zone. I've been vaccinated. I'm free. Yeah. You're freer, but remember, freedom comes with responsibility. We're going to be focusing on that. We're going to talk a lot about that because I think that's a really important thing coming up. Hey, I want to turn to our guests for their final thoughts. Just a little bit of a primer. Tomorrow, really important thing, bring your sunglasses. My biceps is coming out. You're going to see me get my vaccine on this program. You're going to want a little shade for that. And also, and probably more importantly, KDHE Secretary Lee Norman is back to talk about vaccinations. Hey, to our guests, first of all, to Herb and Kuhn from Missouri and Chad Austin from Kansas. Thank you all so much for being on the program. It is great to have you here. I can't wait to get you back because we're going to bring you back when we're really got a better supply of vaccination. It's all about how we're getting it in the arm. So, Herb, let's start with you. Final thoughts from today.
All I can say is go Chiefs. Everybody be safe this weekend.
Thank you. Chad?
Same as well. Go Chiefs, and then just have some patience as we get through this vaccination distribution process, and hopefully here in a few months we'll have as many people vaccinated that we can.
All right. Hawkeye.
Yeah, moving forward, go Chiefs. We don't want you to expand your bubbles and mix your bubbles and have those get-togethers, just as the same as we said for the holidays. We don't want you to do that. But understanding if you can still wear masks in those get-togethers. Try to separate as much as possible. Do those things even if you are not having get-togethers. If you are having those get-togethers, continue to do those mass things of that nature. But we would still encourage you, we aren't out of the woods yet. Everything is looking a lot better in terms of numbers of infections and hospitalizations. But if we can hold out just a little bit further, as Herb said, we have that line of sight for weeks now and hopefully months down the road where things will be much better. Continue to be smart and do those things that we've been talking about.
These are the big days here because we've got excitement. Don't lose focus on what we need to do there, folks. Hey, as we approach the weekend, we want to remind you to send us your fan food favorites. A recipe is something safe, wait a minute, something healthy that you're going to serve in your bubble. Today at 5 p.m. is the cutoff. We're going to pick 2 of those recipes that our health system chef is going to make and serve to us this Friday while we're wearing our red, because we're going to bring it out. Game day jerseys are coming out this Friday. Our chef is going to prepare that. We're going to serve it this Friday as we talk about staying safe in the bubbles for the Super Bowl. We're in February also, which is Heart Month. So remember to make it tasty, but also make it good for us. So thanks to everybody for being a part of our program today. It's been a great day. We love having Herb and Kuhn from Missouri and Chad Austin from Kansas being a part of this program. We look forward to having them back. We look forward to having Lee Norman here with us tomorrow. As we approach this new season of vaccination, it's like the start of a new season, right? It's like the start of the Chiefs season, and you have a lot of anticipation and hope, because pretty soon you're all going to be able to be vaccinated and get back out and party, and that is our collective Super Bowl. But to get there, you got to stay safe. You got to play by the rules. You got to make the right decisions. Do those things. Follow the rules of infection control. Get your vaccine when it's available. Continue to wear that darn mask. And remember, there's still no place like home.